Hello, my name is Dr. Dewan S. Raja. Today I will discuss about diagnosis and treatment of pruritus, also called itching. The diagnostic test for pruritus or itching aim to identify the underlying cause, which can be dermatologic, systemic, neurologic, or psychogenic. So laboratory test. This helps rule out systemic causes like complete blood count, also called full blood count, to check for anemia and signs of infection. Not only anemia, we can also look for the level of the blood cells. In case of polycythemia, all blood cell count will be high. Liver function test. Elevated bilirubin or alkaline phosphatase may suggest cholestasis or liver disease. Renal function test like blood urea nitrogen, creatinine to check for chronic kidney disease or uremia. Thyroid function test for thyroid stimulating hormone and thyroxine or T4. Hypo or hyperthyroidism can cause itching, both hypo and hyperthyroidism. Fasting blood glucose, hemoglobin A1C to assess for diabetes. Iron studies like ferritin, iron, total iron binding capacity. Iron deficiency anemia is associated with pruritus. Serum IgE level, elevated allergic condition or parasitic infection are linked to serum IgE level. Okay, they are related to elevated. This is elevated in allergic condition or parasitic infection. HIV and hepatitis B and C testing for chronic infection that may manifest with pruritus. Dermatologic evaluation for diagnosis. Is there a rash or skin changes? We may go through skin biopsy if the lesion is unclear or to rule out conditions like cutaneous T-cell lymphoma, psoriasis, eczema, etc. Skin scraping, potassium hydroxide preparation for fungal infections. Patch testing to identify allergic contact dermatitis. Diagnosis of pruritus continued. Neurological and psychogenic evaluation. If no physical cause is found, we can do MRI CT scan of spine and brain. If localized itch is suspected to be neuropathic, we may get brachioradial pruritus. MRI CT scan may catch some type of demyelinating disease like multiple sclerosis. Psychiatric evaluation in cases where anxiety, depression, or somatoform disorder are suspected. Other possible tests. Based on history, you can do chest X-ray to check for underlying malignancy. It may be small cell lung cancer, maybe extension of Hodgkin's lymphoma from the neck behind the sternum on the anterior mediastinum, stool, ova, and parasitic exam if parasite infection is suspected, autoimmune workup, antinuclear antibody, ENA panel for lupus or other connective tissue diseases, serum protein electrophoresis for multiple myeloma or other gammopathies. Now we'll go to the treatment of pruritus or itching. General symptomatic treatment used in all patients regardless of cause. Moisturizer, emollient, restore skin barrier in dry skin. Cool compresses, colloid oatmeal bath, soothe the irritation. Avoid triggers, hot showers, should be avoided, particularly in some condition like polycythemia vera or polycythemia of other type. Harsh soap on wool dress up, and this may be allergies and avoidance of allergens, wool dress. Keep nails short, prevent skin damage from scratching. Topical treatment for localized or dermatologic itch. Topical corticosteroid for inflammatory skin condition, that is eczema. Topical calcineurin inhibitor, tacrolimus, pimecrolimus for sensitive areas, pemoxin or menthol cream, local anesthetic or cooling effects. Oral medication for widespread chronic pruritus, we like to prescribe antihistamines, non-sedating like loratadine, cetirizine, daytime use, sedating antihistamine, hydroxyzine, diphenhydramine, nighttime relief. For nighttime relief, these are good. This is for the daytime use. So other medication like that of the gabapentin or pregabalin. This is an anticonvulsant drug, but it is useful in certain type of pruritus, neuropathic or uremic pruritus. Mirtazapine, useful in pruritus worsen at night or linked to depression. SSRIs, selective serotonin reuptake inhibitor like sertraline, paroxetine, chronic pruritus, especially psychogenic. Naltrexone or cholestyramine for liver-related cholestatic itch. Phototherapy, ultraviolet B phototherapy effective in uremic and idiopathic pruritus. So, for the management of pruritus, we must look for the underlying cause on the time, like dry skin, emollient, specific treatment, liver disease, ursodeoxycholic acid, this is a type of bile acid, naltrexone, okay. Another medication is naltrexone. Kidney disease, optimum dialysis, gabapentin, UVB, iron deficiency, iron supplement. Thyroid disease, treat hypothyroidism by supplementing with thyroxine. Hyperthyroidism will give some antithyroidic drugs. Parasitic infection, antiparasitic drug. Allergic or urticaria, antihistamine will avoid the triggers. Okay, if it is due to the body louse or due to the scabies, sarcoptic scabies, we can use benzyl benzoate. And that's all about the diagnosis and treatment of pruritus or itching. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.